Canada is facing related housing affordability and homelessness crises. Supportive housing is one of the tools to solve this crisis. Researchers from Western University have partnered with Indwell, a local permanent supportive housing organization, to understand how supportive housing works. Having created the homelessness crisis through the cessation of new social housing development in the 1980s, more recently through the National Housing Strategy, there is a renewed focus on increasing affordable housing stock. While affordability is a key factor, it isn't the only one. For many exiting homelessness or leaving other public services such as hospital, incarceration, or child welfare, supports are required to sustain successful tenancies. Unfortunately, while dedicated streams exist for new affordable housing, to attach supports to this housing is far less straightforward. Instead, an overstretched mish-mash of health and social services are leveraged to either provide supports outside the home environment or more rarely within the housing environment. Because of this, exits into successful housing for Canada's most vulnerable persons remain a significant challenge.
The idea of providing housing with support for people exiting homelessness or for those leaving long-term mental health care is not a new idea. This is a support system that we've long known is important. Unfortunately, it's just not happening that much in Canada right now. So several research questions drove us to do this work. The first is, how are organizations making supportive housing work in an environment where there's very little funding for such services? Secondly, how are people who are living in these environments experiencing these services? What's bringing them there? What do these services mean for their lives? Thirdly, how do these services integrate within the broader system of supports and services? And finally, do these environments fit within the broader community? How so or how not? And how is community integration being achieved or not being achieved?
This project represents a partnership between the housing provider, Indwell, and researchers from the Centre for Research in Health Equity and Social Inclusion, known as CRESI, at the Faculty of Health Sciences, Western University.
Housing here at Woodfield Gate is really intended for people who are coming out of homelessness or hospital with a number of challenges related to mental health, addictions, and other disabilities. And so supportive housing in this context is actually something very important that is designed really to serve the health and housing needs of people who really need it. Woodfield Gate was a miracle for us in that this was an opportunity to get people out of hospital and get people off the streets now. So it was an empty building that was available to us, and we were able to take advantage of that, make all of the funding work, and I don't think anybody living here would regret that.
This project is being conducted across 3 phases. And in this first phase, we are focusing on talking to the residents of the Indwell Woodfield Gate site and hearing about their experiences of living in a supportive housing environment. So we've interviewed 20 residents about their experiences, and we also had an opportunity, because of the complexities of the current times, to talk about how the COVID-19 pandemic itself is exacerbating some of the challenges that they brought forward in discussing their experiences in supportive housing.
Thus far, we have identified 3 key elements in analyzing interviews with Indwell residents. Our findings coalesce around the following 3 interrelated themes. Number 1, available and timely supports. Number 2, affordability. And number 3, community, but with independence as desired. The first key theme that we discovered is available and timely supports for residents. Available and timely supports are vital in decreasing the use of emergency services while also ensuring individuals' needs are met.
Even just one staff that's dedicated to being able to do conversations with people all day, every day, for issues like being able to talk to somebody, just chatting with them, discussing issues, discussing health benefits, and stuff like that. Having that type of interaction with somebody, it's really helpful. Because when you're not able to get that interaction with somebody, being able to sit there and chat with somebody can really put a strain on your life. It can make you fall into a deeper hole.
The second key theme that we discovered is affordability.
Right now, though, in Ontario, social assistance rates for anybody in OW means that somebody who really needs to get access to housing, whether it's supportive housing or otherwise, really needs to come into a place where their health erodes so badly that they would actually need to get onto benefits. So if we are serious about actually wanting to do something about homelessness, we ought to do something about social assistance rates, either raise social assistance rates so that people can actually have a better opportunity to achieve more affordable housing, or we create options for affordable housing that are affordable to people who have housing stability allowances that are almost half of those folks who have disability benefits.
Well, I was looking for accommodations connected to my disability, so I came up with a list of accommodations that support me in housing, and financial support is one of the pillars. So I'm on ODSP, and my ODSP, there's only so much for housing, and Indwell accommodates that and provides me housing for the amount that I get off ODSP. Then I think they match the rest of the amount for the apartment. So there's a donation or a charitable donation given to the cost of the apartment. So I'm able to afford it. So affordable is primary.
The third key theme that we discovered is community, but with independence as desired. Tenants really value the opportunity to build community amongst each other and with staff to really gain a sense of belonging. The pandemic definitely had an impact on this, but together we were able to create opportunities to minimize feelings of isolation.
Living at Indwell is teaching me to do things that taught me how to get along with better people, be better people, and trust people, and let people do and say what they want.
In spite of these benefits, residents at Indwell also face struggles. Challenges faced by residents relate to: number 1, a lack of conflict resolution skills; number 2, residual effects of institutionalization coupled with the inability of staff to be readily available for less urgent issues; and number 3, rent that, while subsidized, still consumes more than 50% of income. The pandemic served as a sort of pressure cooker, accentuating each of these challenges. From Phase 1, we have the following recommendations. Social assistance rates must be increased to make affordability work better. We can't overemphasize the value of readily available on-site supports. And it's clear that friendships matter and community size matters, with smaller being better.
Supportive housing, there's 4 essential things. Social assistance rates. In Ontario right now, we are privileged to serve folks who are coming out of homelessness, coming out of hospital. Most of those folks are on disability benefits.
Contact us with any questions or comments about our project.